Go back to this and that. We've got Allan Valenzuela with Alliance Physical Therapy. I've never been in this situation before live on television.
Yeah.
All right, we'll talk about a special shockwave therapy. And Allan, welcome to the program.
Thank you.
So, how long has this therapy been around?
This started in Europe, and it's probably more than 20 years old. FDA approved now in the United States for several different things. Ladies would probably really like to have one of these. They actually use it to treat cellulite, believe it or not.
Oh, really? Okay, so what are you going to do with me here in the next two and a half, 3 minutes?
So, real quick, what I'd like to say is, first off, at Alliance, we know that people are suffering with back pain.
Oh, I know so many people with back pain.
It's horrible, you know, and I'm just sitting in your studio and we're talking about your employees even that are suffering from back pain. So we understand that there's a lot of suffering going out there, and we want to be able to change people's lives. You know, we have 10 convenient locations around the Chattanooga area to serve people. So this is a new device. Chronic pain, chronic back pain is a serious problem. The fifth leading cause for people to go to their physicians is back pain. And 80% of the population is suffering from some type of back pain. And our medical costs in the United States probably is consumed by 80% of it is consumed by back pain.
Allan, all right, when you talk about insurance, is this covered by most insurances, or how does that work with this new technology?
Yes and no. Obviously, when somebody comes into the clinic, and I probably should say this, you do not need a referral to come to the Alliance Physical Therapy.
Oh, good.
You can use a free consultation and go in there and sit down with a skilled physical therapist and find out what your problem is, what your pathology is, and they'll diagnose you and tell you what direction you need to go. Send you back to your doctor if you need to, and go from there.
Okay, shock wave therapy. All right, Allan, I'm laying on my stomach. I've already been talking to you about my lower back pain. So what exactly are you going to do to me right now?
So I'm going to let you feel what this device is like, and your audience is going to be able to hear it.
Okay.
This can be a little bit uncomfortable. This is kind of like a jackhammer, okay? But the intensity of this can be adjusted to meet the patient's needs. So did somebody bring, I'm going to wax his back first.
Oh
no, just kidding.
You're going to what?
No. I'm just going to, I don't want you to be shocked when I do this.
Well, I was shocked when you said that.
Yeah, I know. So I'm going to turn it on real quick just so that you can hear it, so you're not shocked when I do put it on you. So that's basically what you're going to hear. And it can be adjusted for, and basically we're talking about the intensity, how hard it hits you.
Okay.
So the intensity or the joules can be turned up or turned down. So it depends on how much pain somebody's in as to whether or not you're going to turn it up or down.
Okay.
And then the hertz is how often it's hammering per second. So we're going to, generally for most diagnoses, we're doing 100 millijoules at 10 hertz.
Okay, that's low
and that's
shockwave?
That's the average you would use, and it's very comfortable.
Okay, let's do this thing.
You ready?
Yeah.
Okay,
We've got about 45 seconds left.
Okay, here it goes.
Okay.
We're going to hit one spot here. I'm going to turn it on. Oh, and he jumped.
Yeah, well, that's not that bad. I think it's more like the noise.
And so,
of it.
and so we can do a static where we're just hitting a trigger point somewhere, or specific pain. We can do a dual treatment where we're moving it back and forth in one area, or we can be sliding it over a surface area. So great for chronic back pain, thoracic outlet syndrome, epicondylitis.
Yeah, that didn't hurt.
Plantar fasciitis. No, and for a lot of people, it's just like getting a massage. So it can be very comfortable.
I was going to say that came close to a massage. Can you move it to my shoulders?
But it just depends. Everybody's sensitivity is different.
Yeah.
And the type of pain they're having is different.
Okay, real quickly, you've got locations all over the Chattanooga area.
That's correct.
And how many sessions are we looking at to control the pain with this new technology?
So we're saying anywhere from 1 to 8. I treated somebody the other day for thoracic outlet syndrome. It took me 1 session, and we reduced their symptoms 100%. We followed up with them after that, and they still have not had symptoms in 10 days.
Okay, all right. As you put that back on my back, I'm going to tell everybody where they can find more information about Alliance Physical Therapy. 10 locations, nopainpt.com. There's a telephone number on the screen. Allan, always a pleasure. This feels actually pretty good.
Yeah, right.
12:58. Have a great day. Talk to you tomorrow.